Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is an overview of RSD and CRPS. RSD stands for Reflex Sympathetic Dystrophy, and CRPS is Complex Regional Pain Syndrome. Both represent chronic pain neurologic syndromes that are very frustrating to both patients and doctors. The basic problem is that there's an overactivity of the sympathetic nervous system resulting from trauma, surgery, or a cause we don't even know. In 1993, the International Association for the Study of Pain changed the name from RSD to CRPS to try and better characterize the condition, but both terms are still widely used in the public's repertoire. The total numbers are unclear as to how many people suffer from these issues, but somewhere between 5 and 12 million Americans suffer from RSD and CRPS. 3/4 of those afflicted are female, and it's unclear why it occurs. We know there's overactivity of the sympathetic nervous system, specifically the sympathetic part of the autonomic nervous system. The trigger sparks up the autonomic nervous system and it just doesn't shut off. So what are the symptoms? Well, as you can see, there's quite a lot of them. It's severe burning pain that is intense and much stronger than would be expected for the injuries sustained. The pain tends to get worse over time rather than better. It starts at the point of injury, but then it can spread to the complete leg or the complete arm, and it can then even spread to the other side. There's usually significant sweating and swelling in the tissues, extreme sensitivity to the affected area. As it progresses, you can get bone and skin changes, and then also can lead to insomnia and emotional issues. There are 3 stages. The first stage is the first 1 to 3 months, is where you see the skin temperature changes, some muscle spasms, the severe burning pain, hair and nail growth that's faster than normal, and then you start to see the beginning of skin changes, blotchy, pale, shiny, sweaty. The second stage is 3 to 6 months. You start to see more skin changes, the nails start to crack, the pain continues to worsen, hair growth slows down, and muscles start to get weak and joints start to stiffen because it's painful to move them, so people just don't move them. Stage 3 is when you get into irreversible changes. The muscles have wasted considerably. The entire arm or leg becomes involved, and you get limb contractions, which is where it's so stiff and you don't move it, so it ends up getting contracted in the position of flexion. Now, what are the treatment options? It's really hard to cure RSD, CRPS, but it can be slowed and reversed significantly. Physical therapy can be beneficial. Medications such as narcotics, antidepressants, blood pressure medications, anti-inflammatories, Tylenol, steroids, neuropathic medications, calcitonin, lumbar sympathetic block or stellate ganglion nerve blocks. Lumbar sympathetic blocks are obviously for the low back. Stellate ganglion nerve blocks work well for upper extremity CRPS. A surgical sympathectomy if the sympathetic blocks work, and then something more permanent is thought to be done. A spinal cord stimulator is an excellent last resort option, which doesn't fix the problem, but it can really help with mitigating the pain, or an intrathecal drug pump. What are the outcomes? Well, it depends on timing. There was a study done 30 years ago in Journal of Bone and Joint Surgery, which showed the treatment started within 2 years of onset have a pretty decent outcome, 80% success. The treatment at 2 to 5 years is 70%, and older than that is 10 to 20%. So the key is to get to it as early as possible, and it's been over 30 years, so the outcomes are slightly better. The Annals of Neurology in 2004 looked specifically at spinal cord stimulator for RSD and showed extremely favorable long-term outcomes. There were some minor complications which are typical of the implants. The spinal cord stimulator movement during motion is not an issue anymore. It used to be. If you're laying down and you stand up, you might get a jolt of pain or something. But the newest ones, they adjust for these changes in position. Lumbar sympathetic block and stellate ganglion blocks. Anesthetic is injected into the stellate or lumbar sympathetic ganglia area. It warms the skin immediately. That's why you know it was placed properly. Pain relief can occur within a half an hour and last for days to weeks. You may need 1 to 2 blocks per week with about 5 permanently to relieve symptoms. Operative sympathectomy may become necessary as well. It's a complicated issue. There's a lot that we don't know, and the presentations are varied. Combination, individualized treatment is typically best and leads to the most successful outcomes. The goal is really to break the cycle of the sympathetic overactivity and reduce the ongoing pain. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.